house. I'm just going to wash my hands real quick and I'll be right with you.
Good morning.
Okay, let's get started. How are you today? My name is Caitlin. I'm going to be your physical therapist.
Nice to meet you.
Nice to meet you. Okay, so before we get started, I just want to confirm, is your birthday April 16th, 1950?
It is.
Perfect. So what we're going to do today is I'm just going to kind of talk to you about why you're here and get a little information. I'm going to be writing some things down, so if I'm not looking at you, just know I'm still listening. And then after that part, we're going to go over to the treatment table and I'm going to do some physical examination of you. Okay, doke?
Okay.
Any questions before we get started?
Nope.
All right, so tell me, what is the reason for your visit? Why are you here to see me today?
Because I was walking with my husband and my left leg gave out and I fell. I don't know why, but ever since then, I've had this pain in my hip.
And how long ago was the fall?
A week ago.
Okay. And then have you had any pain prior to a week ago? Prior to the fall?
Yeah, for about a month, it's been hurting me.
Okay, so have you ever had physical therapy before?
I have.
Okay, so you kind of know the process and what to expect. So what are kind of your expectations or goals for coming to physical therapy for your hip this time?
Well, I'd like to get to the point of walking again, gardening, doing yoga. I'd like to be able to get back to doing those things without any pain.
Okay, perfect. Well, I think that's something that we can definitely work towards, and in the physical exam, we'll kind of dig a little deeper into that. So talk to me about the pain that you're feeling. You told me that it started about a month ago. Is the pain getting better? Is it getting worse since a month ago?
Well, in the mornings it feels very stiff, and then throughout the day it's a little bit better, but I feel like a crunching in there. It hurts to touch. It hurts when I touch it, and just it's a dull ache throughout the day.
Okay. Can you tell me, on a scale of 0 to 10, 0 being no pain, 10 being the worst pain, what your current pain level is right now sitting here?
I would say 8.
Wow, okay. That's pretty high for just sitting. What is the pain the best on a scale of 0 to 10 where you're feeling, what number would you be when you're feeling the best?
A 3.
3, okay. And the worst pain?
8. After walking in here, walking to the parking lot, after walking for a bit is when it really gets aggravated.
Okay. So speaking of aggravating, what are some things, you said walking, what are some things that kind of do aggravate the hip?
Walking,
Okay.
climbing stairs, bending.
Okay. So when you're walking, how long can you walk before you have to stop?
Probably about 10 minutes, I would say.
Okay. And then at that point, is it the pain an 8 out of 10?
Yes.
And then when you rest, how long until your symptoms kind of subside?
With rest, it would go down to a 2-3, and that takes several minutes. 15 minutes, or maybe 20
Okay.
minutes.
Okay. And let's talk about, is the pain constant, intermittent?
It's constant.
Okay. Would you say that the pain keeps you up at night?
No.
No. Okay. Do you feel any pain at night? Are you able to sleep through the whole night?
Yes.
Okay. Good. All right. So, do you feel like the pain is deep inside, or is it closer to the top where you could feel it?
I would say it's deep. I have to push
Okay.
to feel it.
All right. So, have you had any other exams for the hip, or gone to see any other physicians for this?
No, I heard that the physical therapists coming out of West Coast University are top notch, and that's why I called you.
Wonderful. That's very good. Good to hear we have a good reputation.
We have a good reputation.
Appreciate that. Okay, so let's talk a little bit more about your overall health history. Any fatigue, weakness, sweats, night pain, weight loss, any confusion?
No,
Okay. How about your whole body? Any skin issues? Any heart or lung issues?
no,
Stomach, gastrointestinal tract?
nope. I
Overall.
wear hearing aids,
Okay, so.
but I don't have them today.
Okay. Any other?
Oh, yes, I saw a doctor recently because my hands hurt when I'm doing my gardening. My fingers hurt me, and so he diagnosed me with carpal tunnel and arthritis in my fingers,
Okay.
my joints.
And you're under the treatment of a doctor for that right
For
now?
it, yes.
Okay, good.
Yeah, he wants me to put cream and wear braces at night.
Okay. All right. So, any past surgical history?
I had a rotator cuff repair,
Oh, okay. How long ago was that?
probably 10 years or so.
Okay. And how did that happen? How did you tear it?
In yoga, doing a pose.
Okay. All right. Seems like you're very active.
I am very active,
That's great.
and it's important to me to get back to good health.
Okay. Well, that's definitely a good attitude to have.
PT needs to be aggressive.
Okay. We'll definitely work on that. How about any allergies?
None.
How about allergy to latex?
Nope.
Good. And any other illnesses or health conditions that I should be made aware of?
No.
Okay. Any medications?
The doctor told me to take a leave for my hands, so I take one of those every day.
Do you feel like the Aleve helps the symptoms in your hip?
Yes.
Okay. What else kind of helps with alleviating the symptoms that you have in the hip? What other things kind of help with that?
Ice,
Oh, okay.
rest,
Perfect.
and leave.
Okay. So talk to me about, do you drink caffeine or alcohol?
I have 1 cup of coffee in the morning, sometimes at night, and alcohol maybe a couple times a month.
Okay. And then any tobacco use?
No.
Okay. And then talk to me about your health habits. It sounds like you're very active.
Mhm.
Any other things that you like to do besides the yoga and the
I
gardening?
like to bicycle ride.
Okay.
My husband and I have a motorhome, so we like to travel.
Okay.
That keeps us very active.
Okay.
That's it.
All right. So any medical history in your family that you think is important that I know about?
Heart disease,
Okay. What
diabetes,
kind of heart disease?
father had a heart attack,
Okay.
and that's it.
Alrighty. So, you have had prior injuries in physical therapy before, so you kind of understand the process of going through a rehabilitation, and I just kind of want to know what your feelings are about your hip problem.
Well, as I said, I'm very active, and so I'm anxious to start my PT and hoping that it does work and will get me back to, the lifestyle that I had.
Okay.
So,
All right, and talk to me about kind of like your family social life, anything.
well, I'm very close. We have a very close family, and we get together all the time. And I'm a little concerned about falling in front of them. That's an issue.
Okay.
That can be very embarrassing. I don't want to do that.
Sure.
So
Sure. Are you married?
I am.
Oh, that's right. You said you and your husband have a motorhome. Perfect. So that's good. Then was he with you when you fell?
Yes, he picked me up
Okay, so he's in pretty good health.
like the Rock.
Okay.
He's in great health.
All right. Well, you're a lucky lady.
I am.
All right. So, any stairs or in your home or
No, but our motorhome has 3 stairs. You have to go up.
any challenges with that?
Well, yes, it's very painful right now.
Both going up and down?
Yes.
All right, and let's see here. Just a few other things. Any issues putting on clothes or
Well, just the instability of bending over, the concern again about falling, and there is discomfort when I bend over, so putting shoes, tying the shoes.
okay. All right, so that kind of wraps up the portion where I'm going to ask you some questions. Do you have any questions for me?
Nope,
Okay.
just let's get started.
Okay, so now what we're going to do is I'm going to take you over to the treatment area, and I'm just going to do kind of a full body assessment on you, and we can head over there now.
Okay.
Okay, Mrs. Kraus, do you feel comfortable in this sitting position?
A little bit.
Okay, if you have any discomfort, need to get up or move around, just let me know, and that's definitely not a problem. So the first thing we're going to do is I'm just going to do a quick screen of your cranial nerves, which are the nerves that are kind of inside your brain, and they are a pretty big part of our system, actually. They do a lot of our face movements and eye movements and allow us to swallow. So I'm just going to do a quick screen of that stuff. What I would like for you to do, though, is close your eyes right now, and I'm going to get something. And I'm going to put something under your nose. Go ahead and tell me what scent it is.
Coffee.
Excellent. Okay, go ahead and open your eyes. All right. So the next thing I'd like for you to do is cover your right eye and look over to the wall over there. Can you read the first sentence on the wall?
The dog chases the ball.
Perfect. And go ahead and switch eyes. And the sentence below.
The dog's chasing the cat.
Perfect. Okay, great. All right, so the next thing I'm going to do is have you remove your glasses, please. And I'm just going to check with this light here. So go ahead and just look straight at me. Good. Good. Those pupils look great. And actually, you can put your glasses on for this part. I'd like for you to just focus right here on my pen light, and without moving your head, follow the pen light with your eyes. Good job. All right, so the next thing I'm going to do is I'm going to touch your face, and throughout the whole evaluation, I'm going to kind of be moving your body, and is that okay if I touch you?
Yes.
Perfect, all right. So go ahead and close your eyes. I'm going to touch your face and tell me if you can feel it feels the same on both sides. Does that feel the same?
Yeah. Yes.
How about this?
Yeah.
Does that feel the same?
Yes.
Okay, so now what I would like for you to do, you can open your eyes. Can you open your eyes really big, lift your eyebrows up, and then squish your eyebrows down, close your eyes.
Not good for the forehead.
I know. And open your eyes again, and big smile. Can you lift your top lip up like this? Good. And how about blowing your cheeks out like this? Excellent, very good. Okay, so the next thing I'm going to have you do is just bite your teeth together and kind of clench down. Clench again. Good. Clench again. Excellent. And so now what I'm going to have you do is just sitting here, I'm going to come behind and I'm going to whisper something to you. I just want you to tell me which ear you hear it in, okay?
And I don't have my hearing aids in.
No problem. We'll do the best that we can.
Happy birthday.
Which ear? Okay, good.
Happy birthday.
Perfect. Very good. Okay, so the next thing I'm going to have you do is, can you swallow for me, please? Good. And how about a cough? Perfect. All right. So now I'm just going to take this tongue depressor here. Can you say ah?
Ah.
Say ah again.
Ah.
Oh, perfect. Okay. And stick out your tongue and lift it up. Put it down to the left, to the right, and
Like I'm in
then
the dentist office.
you stick out your tongue again and push against the depressor. Good. Push against the depressor. Very good. All
That's
right.
strange.
And the next thing I'm going to have you do is just look to your left and look to your right, and then lift up your shoulders. Does that feel okay?
Mhm.
Perfect. All right, so now we're done with the cranial nerve testing. Now the next thing I'm going to do is just test the sensation of your upper body and lower body. How's the hip feeling?
We're good.
Okay, perfect. So what I'd like for you to do, just like I did on your face, I'm going to do on your upper body. So go ahead and close your eyes. Tell me if this feels the same on both sides.
That is, yeah.
Okay, how about here?
Yes.
And here?
Yep.
Here?
Mm-hmm. Same.
And how about here?
Same.
And how about here?
The same.
Good. All right, go ahead and open your eyes. So what I'm going to do now is just kind of test your ability to decipher sharp touch versus a dull touch. So what a sharp touch is going to feel like, I'm going to use this sterile safety pin. And this is, you can look so you can
Oh.
kind of see what it's going to feel like. That's going to be sharp. And this is going to be dull.
Okay.
Okay, so just go ahead and close your eyes and tell me whether you feel sharp or dull.
Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull.
Good. Okay, go ahead and open your eyes. All right, so the next thing I'm going to do is I'm going to have you just bend your arm like that. Perfect. Don't let me, match my resistance, don't let me push you down, okay? Good. Same thing on this side. Don't let me push you down. Excellent, very strong. Okay, the next one I'm going to have you bring your arm out like this. Bring your hand back like that. Don't let me push you down here. Very good. Excellent. Now we're just going to hold hands here and push out against my hand. This way. Push, 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 push. Good. Same thing. Push, 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 push. Good. Alright, next thing here, you're going to kind of clasp your fingers like that. Don't let me pull your fingers straight. Good. Good. And then hands flat like this. Don't let me push your fingers in. Oh, keep them out. Hold it, hold it, hold it, hold it. Good. Hold it, hold it, hold it. Good. Hold it, hold it, hold it. Good.
Those hurt.
Okay, that's good for that. Perfect. So now what we're going to do is just transition into the lower part of your body. Still feeling okay?
Yes.
Perfect. So, same thing, I'm just going to kind of touch over your legs. Tell me if it feels the same on both sides.
Okay.
All right, go ahead and close your eyes.
Yes.
Does that feel the same?
Same.
Feel the same?
Same.
Do you mind if I remove your shoes?
No.
Feel the same?
Same.
Same?
Yes.
Same?
Same.
Same?
Yes.
Great. Okay, so the same thing that we did with the safety pin earlier, I'm going to do on your leg.
Boy. Okay.
So go ahead and close your eyes. Sharp or dull?
Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. Dull. Sharp. Sharp. The sharp. 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 Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull.
Good. Okay.
Did I do good?
You did great.
Got some meat to go through here. Good. Okay.
That's okay. All right, the next thing I'm going to do is, you can have your hands by your side. Perfect. Go ahead and lift this leg up towards me. Good. And don't let me push this down, okay? Hold, 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 hold. Very good.
This might be a problem.
Okay. Go ahead and lift your hip up. Your leg up.
Curling back.
Try and stay as straight as you can.
Oh,
Does that feel okay?
okay.
Hold, hold, hold. You can do it. Hold, 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 hold. Good. Okay. Just go ahead and extend your leg out like this. Perfect. And drop down just a little bit. Right about there. Good. Okay. Don't let me push you here. Hold, 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 hold. Good. We're going to do the same thing on this side. Don't let me push you down. Hold, 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 hold. Good. All right. The next thing we're going to do is bring your toes up towards your nose. Good. Don't let me push you down here. Hold, 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 hold. Hold, 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 hold. Good. And then toes up. Bring your big toe towards you. Back as far as you can. Don't let me push you down. Good. Good. And then the last one, push down like a gas pedal. Good.
I know what that's called, plantar flex.
Plantar flexion. Good.
Flexion.
Go ahead and push. Very good. Okay. Excellent. So that was great. Now I'm just going to test your reflexes. So you are just going to relax. Good. There we go. Good. Go ahead and just relax. Good. Good. You do the same thing on this this side. Just go ahead and relax. Relax your arm. There you go. Good. 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 All right, that looks good for there. Now I'm just gonna do on your legs here. Okay.
Oh,
Good.
good thing you're standing in front of me.
All right, perfect. And good. Just relax. Good. Excellent. So your reflexes look great. And so the whole screen went really well. So what we're going to do next is I'm going to have you do a little bit of a sitting and walking test, just so we can use it as a measure to compare your first visit and measure your progress throughout the treatment and kind of just see how your balance is. So is it okay if I put this gait belt on you?
Yes.
This is just going to be a little tool I'll use. If you lose any balance, I'll be right there with you. Here are your shoes. Okay, perfect. Go ahead and come on over here to the chair. And just go ahead and have a seat in the chair here. Alright, so the first thing I'm going to have you do is, perfect, you look good sitting there. Are you able to get up out of the chair without using your hands?
Yes.
Go ahead and try. Excellent. Very good. All right, and your balance looks pretty good standing there. Okay, so what if I kind of push you over here? Good. Good. Okay, so I'm going to stand right here with you. Go ahead and just close your eyes.
What are we doing?
Just testing your balance.
Oh.
Keep your eyes closed. Very good. Okay, open your eyes again. Perfect. Very steady. Okay, so can you just turn in a quick circle? Perfect. And how about the other way?
Makes me dizzy.
Do you feel like you need to sit down?
Oh, no, I'm good.
Okay. Very good. All right, so go ahead and have a seat back in the chair. Excellent. Okay, that was very good. So now, I'm just going to have you do a little bit of walking. I'll be right here with you, so don't feel like if you need to stop, you can. That's not a problem. If you have any symptoms with your hip, just let me know. And so what we're going to do, go ahead and stand on up. We're just going to walk down towards the end here and then walk back.
Okay.
Ready?
Ready.
Go ahead. Good.
Back to the chair?
Yes, please. Okay, and go ahead and have a seat. Very good. Okay, so that all looked excellent. All right, so I'm going to score that test, and then we'll finish the rest of the physical exam, and we'll kind of come up with a plan for you so we can get you back to doing your activities. And do you have any questions for me?
Nope, let's get started.
Okay, let me remove your gait belt.
Kind of holds me in. Kind of nice.
All right, so we'll continue with the rest of the exam now.
Okay.
Okay.